Welcome to the Bipolar Disorder Nursing Exam Masterclass, presented by Nagesh Sir of ND Nursing Coaching. This video is designed to help you crack NORCET, AIIMS, and state exams with confidence. Let's start with our first question. Which of the following is the gold standard drug for the maintenance therapy of bipolar I disorder? The correct answer is C, lithium carbonate. Lithium is the gold standard mood stabilizer for preventing manic and depressive relapses in bipolar I disorder. It also has anti-suicidal properties. Next question. A client on lithium therapy complains of polyuria and polydipsia. What is the most likely cause? The answer is A, lithium-induced diabetes insipidus. Lithium interferes with ADH action on the renal collecting ducts, causing nephrogenic diabetes insipidus, which leads to polyuria and polydipsia. Which assessment finding is a sign of early lithium toxicity? The correct answer is B, fine hand tremors and GI upset. Early signs of lithium toxicity include nausea, vomiting, diarrhea, hoarse tremors, lethargy, and polyuria. Seizures and coma are signs of severe toxicity. What is the therapeutic serum level of lithium for a maintenance patient? The correct answer is B, 0.6 to 1.2 MEq/L. This is the therapeutic range for maintenance lithium. Levels above 1.5 MEq/L are considered potentially toxic. A patient in an acute manic episode is constantly pacing. Which nursing intervention is priority? The priority intervention is B. Provide finger foods and high-calorie fluids. Manic patients are highly active and may neglect nutrition. Finger foods and high-calorie fluids prevent dehydration and malnutrition while they are moving. Which anti-seizure medication is used for bipolar disorder and requires monitoring for Stevens-Johnson syndrome, SJS? The answer is C, lamotrigine. Lamotrigine can cause severe skin rashes, including SJS, if titrated too quickly. Patients must report any rash immediately. Bipolar I disorder is characterized by which of the following? The correct answer is B, at least one manic episode. Bipolar I requires at least one full manic episode. Although major depression is common, it is not required for the diagnosis. Let's consider the next question. Which lab value is mandatory before starting valproic acid? The correct answer is B, liver function tests, LFTs. The rationale is that valproic acid is hepatotoxic, so LFTs must be monitored periodically to detect early signs of liver damage. Next question. Flight of ideas is a speech pattern commonly seen in which condition? The answer is C, mania. Flight of ideas is a rapid, continuous speech pattern where topics change based on associations, characteristic of manic episodes in bipolar disorder. What teaching should be included for a patient taking lithium regarding their salt intake? The correct answer is C, maintain consistent, adequate salt intake. Lithium and sodium compete in the kidneys. Inconsistent salt intake can lead to toxicity or reduced drug efficacy. Which of the following is an atypical antipsychotic often used in acute mania? The answer is B, quetiapine. Quetiapine is an atypical or second-generation antipsychotic effectively used for both acute mania and bipolar depression. How is rapid cycling bipolar disorder defined? The correct answer is C, 4 or more mood episodes in 12 months. This is the official diagnostic criterion for the rapid cycling modifier in bipolar disorder. Which side effect of carbamazepine requires immediate reporting to the doctor? The answer is B, sore throat and fever. This indicates potential agranulocytosis, a serious side effect, which is a dangerous drop in white blood cells and signals infection. What is the definition of cyclothymic disorder? The correct answer is A mild form of bipolar disorder lasting at least 2 years. Cyclothymic disorder involves chronic, fluctuating hypomanic and depressive symptoms over a minimum of 2 years. During an ECT, electroconvulsive therapy session for a manic patient, what is a primary nursing concern? The correct answer is B, maintaining airway patency after the procedure. Because ECT involves general anesthesia and muscle relaxants, protecting the airway post-procedure is the highest nursing priority to prevent aspiration. Which neurotransmitter is considered most elevated during the manic phase? The answer is B, dopamine. The monoamine hypothesis suggests that mania is associated with an excess of dopamine and norepinephrine. What is a priority nursing diagnosis for a patient experiencing severe mania? The correct answer is B, risk for injury. Due to hyperactivity, poor impulse control, and reckless behaviors, the primary nursing diagnosis in acute mania is risk for injury. Which diet is contraindicated in a patient taking lithium? The answer is A, low sodium diet. This is because a low-sodium diet causes the kidneys to retain lithium, which can lead to rapid accumulation and toxic serum levels. A hypomanic episode must last for a minimum of how many days? The correct answer is B, 4 days. Hypomania is less severe than mania and must last at least 4 consecutive days for diagnosis. Which medication has a significant risk of causing gray baby syndrome? The answer is C, lithium, due to the risk of Ebstein's anomaly. Lithium use during the first trimester of pregnancy is associated with this cardiac defect. Which behavior is typical of bipolar disorder? The answer is A, grandiosity. Inflated self-esteem or grandiosity is a hallmark symptom of manic episodes in bipolar disorder. What is the most effective approach for a patient exhibiting aggressive behavior during a manic episode? The correct answer is B, setting firm, consistent limits. This provides external structure for manic patients who lack internal controls, helping maintain safety and reduce agitation.